This is the first webinar in the Minnesota Drug Diversion Prevention Pathway webinar series, introducing you to Minnesota's drug diversion prevention pathway and the accompanying toolkit. A review of drug diversion investigations in Minnesota's long-term care facilities and pilot site testing of the pathway highlighted. Diversion can happen at any facility, and every facility has opportunities to improve process. There is infinite creativity in drug diversion when addiction is involved. Poor adherence to policy or process can make diversion easier. And vigilance is necessary for detection of diversion. The pathway was built to help facilities recognize opportunities to hardwire safeguards into practice to decrease vulnerabilities. The Minnesota Drug Diversion Prevention Pathway and the accompanying toolkit were developed to provide a structure for leaders and staff to assess and address drug diversion vulnerabilities in their long-term care or assisted living facilities. The pathway is intended to guide leaders through a systematic framework to ensure they assess the entire medication process from prescription to administration, documentation, and waste. The accompanying toolkit provides well-researched resources so leaders who want to address their facility's risk do not need to start from scratch. The pathway is not something to overwhelm you. It doesn't create additional regulatory burden, and it is not another set of expectations for leaders. Its purpose is to provide guidance and tools for leaders who want to improve their facility's process. The administration of prescription medication in long-term care is complicated, with a lot of overlapping elements. The drug diversion prevention pathway was organized to decrease that complexity. It is based on the life cycle of a prescription, from prescribing and dispensing to destruction and the waste of unused doses. We have 3 additional categories: hiring and management practices, education and ongoing monitoring and investigation. The pathway provides a systematic way for leaders and their teams to assess facility systems and adherence to best practice in all of these areas. It usually takes less than an hour to do the initial review. Recommendations have been ranked based on effectiveness and ease of implementation into 2 categories: core interventions and advanced interventions. Core interventions should be able to be implemented by any long-term care facility. Advanced interventions may require additional staffing or resources. We have provided a toolkit so facilities can easily implement recommendations. They are customizable and correspond to many of the recommendations in the pathway. The toolkit consists of 4 categories. 1. Education. This module includes curriculum outlines, slide decks, orientation checklist components, competency content, and check-off templates. 2. Templates. This module includes draft letters to care partners to communicate or request changes in process. 3. The Leadership Guidance module includes guidance documents to help implement or complete specific interventions in the toolkit. 4. Equipment. While the team did not recommend specific brands, this module should help facilities as they start searching for equipment that helps to prevent diversion. These are examples of the draft letters to the pharmacy, the facility's delivery service, and the medical director. The Leadership Guidance and Resources section includes guidance documents on hiring practices, how to complete a controlled substance administration review, how to complete an internal investigation, completing a physical plant assessment, and proactive staff safety interviews. The toolkit includes curriculum for all staff education, and content, curriculum, and competency checkoffs for clinician education. The curriculum and competencies are customizable to each facility. While the Drug Diversion Prevention Pathway Advisory Team does not recommend specific supplies or equipment, it does include guidance or concepts to think about when considering supplies and equipment that could decrease vulnerability to diversion. To implement the pathway, choose a time and invite stakeholders. Read through the pathway section by section. After each section, discuss where your facility is. What is in place? Are you sure? Do you need additional information? Where are your opportunities? After reviewing the whole pathway, discuss your opportunities for improvement or to investigate current process. Identify your highest priorities. Document your assessment. Choose a manageable number of interventions based on resources. We recommend 3 to start. Make a plan. Identify stakeholders. Plan your communication across the facility. Craft a timeline. Identify process measures and expected outcomes. And plan for evaluation and adjustment. Once you have done this, thoughtfully implement your plan and ensure it is embedded. Once you have implemented new process, it is worth going through the pathway again to identify the next set of priorities and processes you want to put into place. The pathway and the toolkit are available at www.apiaryconsulting.com under the Project Links tab. We are excited to hear about how you have used the toolkit to make your facility less vulnerable to controlled substance diversion.